Wow, we're live. One
Yeah.
second. We're live now. Hold on. We lost Abuja, but we can get started until they get here. Okay, Dr. Rob, we're gonna improvise. Hi, everybody. Welcome again to a Love Your Menses community webinar. Today, we're going to be presenting colorectal cancer awareness to the people of Abuja. Just because of technical issues, we don't see them right now, but they're present watching us. It's just we can't see them. My name again is Dr. Azuma. I'm the host of this, or actually moderator of this event. I'm the co-founder and president of Love Your Menses, and we're just so excited to be here. I'm going to be presenting the colorectal cancer awareness by presenting the speaker. But before I get started, I want to thank Chief Joseph Guba from Abuja for allowing us to use his venue to present this colorectal cancer awareness day. So I'm going to now add, hi guys, Abuja is here. Vera, we did an introduction already, but before I introduce Dr. Rob, I'm going to have you say something, Vera. Go ahead. Unmute yourself, Vera. Wow. I don't know if Vera can unmute herself, but here's the colorectal cancer screening. And yeah, all the people present. Let me see if I can feature them. Look at all the people present to listen to us give this talk. Hi, guys. Hi, this is Dr. Azuma. Hi, hi, hi. Thank you so much. Chief, thank you so much for allowing us to be here. Can you guys unmute yourself? Can you guys unmute yourself?
Okay, can you see us?
Yes, I can. Let's give you
Okay,
guys the
that's
platform.
okay. This is the guy for the sugar test, blood test. Hello.
Yes, we can hear you. Hi, doctor. Thank you. Thank you for doing diabetes screening. Thank you. Thank you. Okay, Ada, do you want to do an introduction, please?
Yes, I would love to.
Okay, you have the platform now.
Okay. Hello, everyone. Good evening.
Good.
Afternoon. Okay. These are doctors all the way from the U.S. Wonderful people. They are here to give us a talk on cancer, rectal cancer awareness. While we're living, we need to be conscious of our health. And these people have gone out of their busy time to give us a talk on that. So they really appreciate your presence today. And I would love to introduce each and every one of them. The main speaker is Dr. Rob. Dr. Rob will be talking to us on colorectal cancer and the symptoms and the preventions, how you could prevent it from occurring. And then we have Dr. Ebere Azuma. Dr. Ebere Azuma is the co-founder and president of Love Your Menses. Those of you that have been enjoying Love Your Menses products, free pads, she's the one, and she runs with the founder, Brian, but she's not here. So we also have a colleague in Lagos. She'll be joining us soon, Vera, the the coordinator. Sorry, people are still moving in. We have a large crowd today. So we'll be having four guests speaking to us. Okay, Vera is there. Vera Martins, Lagos. That's Love Your Message, coordinator Lagos. Vera, how you doing? Thank you. And that's Dr. Rob. Hello, Dr. Rob. Everybody saying hi from Nigeria. So Dr.
Hi.
Rob will be talking to us on colorectal cancer awareness today. You're all welcome. Dr. Iberi is an amazing moderator, she's a mother, she's a sister. So please, just relax and listen. So you'll be able to get something home. Thank you so much. Thank you, Dr. Bibi. Thank you, Dr. Rob. Thank you, Vera, for joining us. And thank you, everyone, for attending. Thank you so much. And also, I want to acknowledge the presence of our very own Chief Joseph Guba. He's an amazing father. In fact, I don't know how to start. Remember, I told you that I had a venue before now. And he said no. He will want all members of this community to be part of this. And he has made that possible. This is his palace. Who does that? He gave us his palace to use. So we owe him a lot. We appreciate him for that. We appreciate his family. His family seated here with us too. So we appreciate him. Thank you, Chief Guba, for these kind gestures, and may God reward you for this. And as you can see, like I said, this gentleman here, Pharmacist Sunday, will be carrying out the blood sugar test and the high blood pressure test, free test today after the talk. We'll be doing that outside. So the hall is loaded with people, filled with people waiting for you guys to explode your knowledge. Thank you so much. We appreciate it.
Wow, thank you so much, Ada, for that introduction. Is it possible for Chief to say something? Because we would love the Chief to say something, if that's okay. Thank you, sir.
Hello. Dr. Mary.
Yes, ma'am.
Dr.
Yes, ma'am.
Rob.
Yes.
And Vera Martins, my co-coordinator in Lagos. This is my sister, my friend, my classmate back in Abuja Nigeria. She happens to, in fact, she's a wonderful woman. My first program in this community, when I had, that was during the December period when we did Love Your Menses program outreach. She was the one that organized the program on my behalf.
We thank you. We thank you. Thank you.
She actually gave me her center to run that program. Then secondly, she was the one that linked me. She linked me to, she linked me to the chief of this place. And that was how we came about this venue. So please, I want you guys to also appreciate her efforts. She's been a nice lady, and she's also up for Love Your Menses. Thank you so much, Esther.
Thank you, Esther. Thank you so much. Ada, can the chief say something, please? We can't come to someone's house without acknowledging and letting the person open up the house. So please, can we hear from the chief, if that's okay with him? Thank you. Hello, Chief. How are you? I was born in Just, so I would say now. Wait, how do we say it? How do we say it, Ada? Louder, Chief. Louder. Thank you so much, Ada. Thank you, Chief, again. So at that, do you want us to start? At that, we're going to start with introducing Dr. Rob, and Dr. Rob will take over. And then after Dr. Rob is done, we'll have Vera now present Love Your Menses. So now I'm going to present Dr. Rob. Dr. Rob is a board certified trained colorectal surgeon who has been practicing surgery for 16 years. Dr. Amajoy was born in Kakuri, Kaduna. Then he left for Imo State after his father, Mr. Demian Amajoy, left for the United States. Mr. Demian Amajoy is a remarkable man, a loving husband, and an amazing father. He was the first from his village to have left for the United States. Dr. Amajoy then went back to Imo State and attended Ikenobu Primary School in Owerri, where he was a star student. He then went to Government College Owerri, where he completed his junior secondary school education, again as one of the top students. He then left to join his father in the United States in Kansas City, Missouri. He completed his high school education there and then went on to complete his undergraduate and medical education at the University of Missouri. He then went to Long Island, New York for his residency. And even after completing his residency in general surgery, he went ahead and studied colorectal surgery as a fellow. After that, he began working in Long Island, New York. And at that time, he was the director of the rectal cancer. Sorry about that. He went to New York to work. And after that, he was the director. However, he currently lives in Kansas, and he's the director of the rectal cancer program at St. Luke's Cancer Institute. He's also an assistant professor at the University of Missouri, Kansas City. He was recently appointed the chair of colorectal surgery for the International College of Surgeons. Dr. Amajoy is an academician. He has authored many articles, book chapters, abstracts, and reviews. He has presented his findings at national and international meetings. Dr. Amajoy specializes in treating rectal cancer, colon cancer, anal cancer, sigmoid diverticulitis, and just anything bowel. He's very humbled to be here in front of Chief Joseph Guba and his people. So he's just grateful that you made it possible. He hopes that one day he will come back and practice in Nigeria. So I'm going to hand it now to Dr. Amajoy.
Thank you, guys. Good evening. I'm Dr. Robert Amajoy. Chief Guba, thank you very much for allowing me to do this. You see what you have done. All of a sudden, you have many, many people in that room, and I can be more proud of you guys. Thanks, guys. Okay, so March is Colorectal Cancer Awareness Month worldwide, actually, and that's why we're doing this month. This is March. And colorectal cancer is a very important cancer because it's the most preventable cancer. It's one of the it's very common. It's the third most common cause of cancer in the bowel, but it's the most preventable cancer. That's why we here to talk about it because it can be prevented by certain things that you can do to help yourself prevent it. So here are my slides, Dr. Barry. So I want to start by talking about a patient. This is not a real patient, but it is a case presentation. So Mr. Abubakar is 48 years old, and he has been having blood in his stool for the past 5 months. The blood is bright red blood. He doesn't have any tummy pain, but he has lost about 20 pounds, I'm sorry, 20 kilograms in the past 5 months. So I just have this case presentation. You can start thinking about, as I give the talk, so everyone can start thinking about Mr. Abubakar. So, what do you think Mr. Abubakar has? Do you think he has a pile? I mean, he has blood in his stool, and the blood is bright red blood. Do you think he has, inflammation in his colon or rectum, or do you think he has colorectal cancer? Most people will say pile, but you want to make sure you know that there's different things that it can be. So don't pigeonhole yourself on thinking that it's just a pile. Next slide, please. So, what do you think Mr. Abubakar should do? I mean, he has bleeding from his rectum. He has blood in his stool. He has lost about 20 kilograms. What do you think he should do? You think he should take malaria drugs? Do you think he should go to his doctor for rectal exam? Or do you think he should ask for colonoscopy from his doctor? So very important to think about. Obviously, this is not malaria. I think option number 2 and number 3 is a must. Mr. Abubakar should go to his doctor for a rectal exam, and then Mr. Abubakar should be talking to his doctor about colonoscopy and or how to screen or check the colon. Okay, next slide, please. So today, I want you to learn about the anatomy of the colon and the rectum, and I want you to understand what colorectal cancer is, and I want you to know how you can actually prevent this and reduce your risk and protect yourself from colorectal cancer. Next slide, please. So here's the anatomy. You know, I put this slide in here because a lot of people are confused about what's actually in the belly or in the tummy. What's in the tummy is the stomach, as you can see on the left hand side here. What's in the tummy is the stomach, the colon, and the small intestine. And as you can see on the right side there, the colon has different parts to it. There's a part on the right side which is ascending colon and transverse colon, and a descending colon and the rectum. The colon, when you stretch it out, is about 5 foot long in the average adult. So 5 foot long. It's almost like the height of a human being. So it's a long organ. It's a big organ. So think about that. It's all in your tummy, and things can happen to it depending on what your risks are. New line, please. This is what the colon looks like inside. It's a place where the sun don't shine, but in this case, we can actually see it by putting a scope through the anus and going into the colon. You can see this is what it looks like inside, especially when the person has done colon cleansing. This is what it looks like. This is a healthy colon. This colon has no problems with it, and this is exactly what it looks like when it's healthy. No polyps, no cancer, nothing. New line, please. So, about colorectal cancer, worldwide, colorectal cancer is the third most common cause of cancer in both men and women, behind lung and breast cancer for women and lung and prostate cancer for men. 1.3 million diagnoses every year. Especially in 2020, it was 1.3 million diagnoses of colorectal cancer worldwide. So that's a lot of people. And there's about almost 1 million deaths from colorectal cancer worldwide in 2020. In Nigeria, about 4 out of every 100,000 people is what we see for colorectal cancer, and there's a rise in colorectal cancer in Nigeria, especially. And 1/3 of the people that are found to have colorectal cancer in Nigeria are actually less than 40 years old. 1/3, and that is quite a large number. So this is not an American problem or any other country's problem. This is actually a huge problem in Nigeria. And the funny thing is, we don't really know the real data because there's not enough data coming out from Nigeria. Um, So most patients in Nigeria who present with colorectal cancer present very late with symptoms, and that is what the problem. Most of the problem is in Nigeria is because there's no screening. Nobody knows what the risk factors are, um, and there's not a widespread screening of colorectal cancer in Nigeria. So what that means is that most people present when the symptoms are very, very uh, bad, and it's usually late sometimes. And so, what I want to do today is to make sure that you guys, everyone that attend um, this conference, understands to what to look for, and also help you prevent some of the risks associated with getting colon cancer. Okay, new line, please. New slide, please. So this is what polyps look like on the left side. So what is happening is, remember the colon that I showed you earlier, normal colon wall, no problems. What happens is the polyp starts to really like grow, and that polyps starts growing just because the cells in the colon loses the ability to control themselves. Because every cell in your body has an ability to control itself from growing. That's why your hands cannot grow any faster than any more than it has grown already. Your eyes cannot grow any more than it has grown already. So every cell has ability to control itself from growing. But when a cell loses the ability to control itself from growing, that cell starts to grow like crazy, basically, haphazardly. It starts to grow all over the place. And then because it has lost its ability to grow, it can end up with um, more mutations, which is alterations of the cells that can ultimately lead to cancer. So that's how it begins. On the left, there's polyps. And then on the right is what a cancer looks like. As you can see, the mass has grown quite a bit. And this is when they start to cause problems like bleeding, bloating, like basically clogging up the pipe and causing an obstruction, like it can't pass through, or it can't pass gas, or it can't move, pass air from the colon anymore, because this mass continues to grow and it continues to obstruct that lumen. Remember, the colon is a pipe, and it's a pipe, and when you really think about the colon as a pipe, I think I told you before, it is 5 foot long, and when you fillet it open, like you cut it along that pipe, the axis, and fillet it open and lay it, like open it up like a book, there's a lot of surface area for things to happen. There's a lot of cells there for things to happen. So what you eat, all these cells in the colon sees them all the time. Whatever you eat, remember, what you eat is not sterile, right? All the things we eat is not sterile. Nothing is sterile, and things that we eat can have some compounds in them that can actually be dangerous to the cells in the colon. So sometimes the cells in the colon are constantly being bombarded with a lot of something we call carcinogens, which are compounds in that can be found in food, sometimes as preservatives, and sometimes that's just how we cook the food. Uh, that can cause injuries to the colon linings, and the cells can then start to grow and become cancerous. So that's what cancer really looks like. Next slide, please. And what I just told you is exactly what this slide shows, how cancer begins. And these cancer can go, I mean, the polyps can go from polyp stage to cancer stage, and that can take anywhere from 5 to 10 years. As you can see, on the left side there is a normal cell, and toxins, carcinogens, whatever we eat, some genetic mutations can cause mutations in the cells, and the cells can lose the ability to grow, and control their growth, and then more mutations can then end up leading to cancer. And that can take anywhere from 5 to 10 years. The reason why we recommend screening colonoscopy, or doing screening period, in any way, shape, or form that screening can be done, is to interrupt the sequence, to interrupt the progression of polyp to cancer. Because if you can remove polyp, cancer is prevented. That's why colorectal cancer is the most preventable cancer, because if you remove polyp, cancer is prevented. Next slide, please. So, what are your risk factors? There are, modifiable risk factors. Maybe what I mean by modifiable is the things that you can control, and there's some risk factors you cannot control. You cannot control the risks, or like your age, for instance, as we all are gonna be, you know, high risk at some point once we are above a certain age for colorectal cancer. Uh, So once you're above age of 45, you already automatically average risk for colorectal cancer, and you should be scoped at that age. So you cannot really control the age. Then everybody's going to age. So therefore, once you're age of 45, you need to get colonoscopy. That it puts you at risk of getting colorectal cancer. So you need to get colonoscopy at that age. Um, and family history you cannot really control, because if your family members had colorectal cancer, there's a chance that there may be a genetic component. Maybe it runs in your family, so you can't really control that. But the things that you can control, like making sure you go see a doctor, make sure you have a doctor that you need to be seeing. Don't say only when I get sick is when I see a doctor. That's the old type of medicine. The new type of medicine is, or medical care is, make sure you have regular checkups, regular screening. That's the newest part of medicine. The oldest part of medicine is just going to the doctor when you're sick. No, you need to see your doctor for certain things. And that's why we have Love Your Menses there. There's some things that can be checked before you get sick. You don't want to get sick. Sometimes it may be too late. So the other thing that you can control is how much meat you eat. How do you make your meat? Do you flame it? Do you uh, put it in a high heat? Do you have flames and smoke hitting your meat and covering your meat all the time, and then you eat that? Because remember, smoke has a lot of problems in it. Um, smoke can come from primary or secondhand smoking. So you want to avoid smoking. You want to avoid secondhand smoking. Next slide, please. So what I was alluding to before, if you remember, this sounds familiar to most people. Look at that meat on the right corner, on the top right corner there. See all that dark meat? I know we can't wait to eat that. You look at it and you can't wait to eat it. Me too. I can't wait to eat it. But you have to make sure that you're ingesting these things with caution and in moderation, because on that meat is a bunch of carcinogens from all that flame. The smoke that you see when you cook and has carcinogens in them. I think I mentioned what carcinogens are before. Carcinogens are compounds in smoke. It can be in smoke, and that's why smoking actually has been outlawed. And it's not outlawed, but it's not recommended in America at all. Everybody knows that. So all these things are deposited on the meat, and then when you ingest it all the time and eat this all the time, day after day, week after week, month after month, year after year, what do you think the cells in your colon are seeing? The cells in your colon are seeing these compounds, these carcinogens all the time. So you have to be very careful how much of this that you take, how much of this you take, right? So be careful how much of this you take. I'm not saying don't eat meat at all, but you can limit the amount. Next slide, please. Smoking is also another big deal. And this is the data from USA. 20% of adults are current smokers, but that number is actually higher in Nigeria. Because Nigeria is just, it's your choice. There's no problem. You just smoke away. Um, in America, there's been a lot of efforts to limit smoking. There's no smoking in public areas in America. There's no smoking in hospitals. The hospital I used to work in the 1950s, surgeons used to smoke in the operating room. While they operating, they're smoking and they put cigarette down to operate. That is how far we have come. So in America, there's no more smoking in public areas. It's not recommended at all. So, but this number is higher in Nigeria. Um, and like I said before, smoking delivers carcinogens like carbons and beta naphthalene to the lung, and then once that then goes into the lung, remember the lung is the organ that circulates all the blood to the rest of the body. So it takes all these carcinogens with them and deposits. Say, hey, here's colon, how's your carcinogens. Prostate, here's your carcinogens. Breast, here's your carcinogens. Blood cells, here's your carcinogens. And when you get, blood cells to get carcinogens on them, you can develop things like leukemia, breast cancer, prostate cancer. So that's why smoking is actually the number one cause of cancer in the world, period. The number one single cause of cancer is smoking. Because once you get it inside that lung, the lung just deposits it to all the organs in the body and gives them their own portion. So you have to remember, it's not just you smoking, it's also secondhand smoking. Other people smoking around you that you're inhaling, or when you're cooking, all of that stuff is all big time risk factors. Next slide, please. Um, Somebody said louder, please. Can you guys hear me okay? I think I think they can hear me well. Alcohol is another risk factor. Basically, 3 drinks a day can increase the risk of alcohol about 41%. Okay, so if you're drinking a lot of Star and Golder and Lager beer, all of that, you want to limit that. You know, there's an amount for women and there's an amount for men. So you want to limit the amount you drink. For women, it's less than 1 drink a day. So for those who drink, if you're putting your head down and laughing about it, um, just remember, I'm not saying you cannot drink at all. It's just how much you do. And we all know ourselves. We just got to not do too much of these things. So for men, it's only 2 per day. For women, it's only 1 per day. If you do more than 1 per day, there's something wrong. Next slide. So, and as you can see in that bottom slide on the left, is a woman cooking in the kitchen. She's carrying her baby. This is a normal occurrence. This is nothing. This is just the reality in Africa and Nigeria, right? Most places, they cook outside or they cook in a close area, and sometimes they carry their baby too. As she's inhaling the smoke, the baby is also inhaling the smoke, and then we wonder what happened. So this is real, and I think everybody needs to understand that and sort of help themselves out here. Next slide, please. So, um, what we have discussed, we've talked about the anatomy of the colon, and we talked about how the colon is 5 foot long, and how things can happen to it. There's so many cells in the colon. We've talked about how you can prevent colorectal cancer by exercising, eating right, the right foods and the right amount, not too much. We talked about decreasing alcohol. We talked about secondhand smoking and firsthand smoking. For those of us who our spouses, husband or wife smoke at home, just because she's the only one smoking doesn't mean that you're not also smoking. You're also smoking. You have to remember that. And we also talked about what colorectal cancer is. Now that you know what colorectal cancer is, next slide. Next slide, please. So now that you know what colorectal cancer is, good health is no accident. It's never by accident to have good health. You may be lucky over time, but one day it will get you. So good health is no accident. You have to have a conscious, deliberate effort to make sure you're healthy. You have to exercise, you have to eat right, and you have to get regular checkups and go see your doctor, talk about these things. They're not secrets, just talk about them. My goal is to educate, to help educate, not to scare you, not to make you afraid of this. These are facts. They're not for anybody to be afraid of. It's just for you to be aware because health is in the awareness. If you're not aware, how could you even? In fact, you lose the match before before the game begins. Before the game begins, you've lost the match if you don't know, if you're not aware at all. So the whole idea is to make you aware, so you at least don't lose before the match begins. So next slide, please. So you can't get out of here without a quiz, right? I'll see how many people get this right. To prevent colorectal cancer, what should you do? One, is it reduce meat intake? Is it reduce alcohol intake? Is it exercise regularly? Is it ask your doctor about colorectal cancer screening? Or all of the above?
Vera, Ada, we want someone to answer it. Ada, can you get someone in the audience to answer it?
Okay.
That will be the first person to get the gift for them.
You was asking a question. Please, can you ask the question again?
Okay.
Yes. Doc,
So
can you ask the question again?
yes. So I'm asking. So it's a quiz on the screen, right?
Okay,
So
she
I'm
has an
asking.
answer.
You have an answer?
Dr. Rob, they said all of the above. Who said it?
She said.
All right. Dr. Rob, is that the correct answer?
That is the correct answer.
Yeah.
Please let's clap for
Yeah.
her.
Yeah. At that, she's going to be the first person to get a gift from us on behalf of Love Your Menses. All right. Dr. Rob, back to you.
Yes. So if you can go back to the original slide, the beginning of the slide, we're just going to end with Mr. Abubakar.
All right. I'm
So,
going.
so if you remember Mr. Abubakar again, he is 48 years old and he has been having rectal bleeding for the past 5 months. The blood is bright red and there's no tummy pain, but he has lost 20 kg in the past 5 months. That's a lot of weight. What do you think he has? Um, with the amount of weight loss that he has had with the bright red blood, there's two things he could have. One is the inflammation of his colon, and the other is colorectal cancer. Piles don't really cause you to lose weight. Okay, so piles can cause bright red blood, but it doesn't really. Inflammation of the colon can cause you to lose weight just from poor eating, but colorectal cancer do cause a lot of weight loss, causes a lot of people to lose weight. So the chances that he has colorectal cancer is very, very high. And that is why, what is the next thing that you think he should do? I think that's the next slide.
Mhm.
So, what do you think Mr. Bobaka should do? Let's see who has the answer to this question. We're going to go around the room again. Somebody's raising their hands already. The lady in the orange shirt, she raised her hands first.
You should see the doctor so that you should take medical properly care.
I didn't hear her.
I will translate. She said she should, Mr. Bubakar should see the doctor.
Okay. Now take malaria medications, right?
Yes. Yes, doc.
Well, you guys have done amazing, and I cannot be more proud. I cannot wait to come back to Nigeria at some point. You know, I was born in Kaduna, Kakuri, Kaduna, and I was in Abuja 2019, and I can be more proud of the Nigerian people. And I can't wait to see you guys again. And Chief Guba, Joseph Guba, I appreciate you. Thank you so much for what you've done. Because this knowledge right here, people will never forget it. Trust me. And I thank you very much. Thank you.
Thank you again, Dr. Rob, for that awesome presentation. Before we open the floor, I want to invite our coordinator from Lagos to give us a statement. I don't think she's here. At that, I don't see Vera. Okay, so Vera is not here yet. So we'll go back to our first plan, which is question and answer. If there are any questions in the audience, please raise your hands and we would give you the mic. Thank you. Farah, Ada, are there any questions?
Yes, they do. Yes, they do have.
Okay, so go ahead. Can they start with their name and then the question, please?
Your name, your name. My question goes like now, for example, someone your name. My name is Helen.
Mhm.
My question goes like Now, for example, if someone is having that breast pain and is not letting go, what would they call that? Is it cancer?
All right, she's asking for one who have a breast pain and they're not regenerating blood. She wants to know if it's cancer. Just breast pain, pain, pain,
All right, can you guys mute it? So what I heard her say is she's having breast pain and she's not urinating. Is that correct?
Yes, yes, yes.
Okay. Dr. Rob, do you want to take it? I know it's nothing related to the colon or the rectum, but if you want to say something to it, go ahead. Unmute yourself, Dr. Rob. Unmute, please.
Yeah, I'm sorry, guys. So, Kelly, I'm sorry to hear that's what's happening. But the first thing, Kelly needs to do is
Helen. Mhm.
Helen. Okay, the first thing Helen needs to do is to go and see her doctor. Okay, um, you're not a doctor, right? So you can doctor yourself. Go and see somebody in a clinic and just tell them what's happening so they can examine you and see what's happening. Okay. But looking at you, it's hard to know whether there's anything going on, but at least it will give you peace of mind to know that there's nothing happening. Okay. Some of these clinics will be able to attend to you and just have a doctor take a look because you want to know ahead of time before anything bad really happens. Okay.
Correct. Yes. And it's important to urinate. So if you're not urinating, in our opinion, it's an emergency and you need to see a doctor as soon as possible. Thank you. Are there any more questions, please?
Yes. Can you be loud, please? Use it loud.
My name is Dorian. The family history issue. That's okay if your family is fine with this. How will you feel about it? How can you excuse yourself from this?
Esther, I heard about family history, but I didn't hear
Yes.
the question. Please.
Okay, the lady asks that if she belongs to a family that has colorectal cancer, so how can she excuse herself from this ailment as a member of the
Excellent
family?
question. Excellent question. Dr. Rob, Gloria says she has a family history of colorectal cancer, and how can she prevent herself from having colorectal cancer? Your turn.
So that is a very good question. Okay. So the only way, Gloria, to prevent colorectal cancer is to get screened. How old are you, and how old were your who in your family has a colorectal cancer? Can you ask her that question, please?
Sister Esther, can you ask her those questions?
Who in your family has that cancer? Okay.
Okay, she says nobody. She doesn't really know of anyone, but she just thinks in case.
Okay. You heard, Dr. Rob, it was a hypothetical question.
Oh, okay. So if a family if there's a family member with colorectal cancer, everybody should get scoped or get screened, get their colon looked at the age of 40 or 10 years younger than that first degree relative who had the colorectal cancer. So if let's say your mother had colon cancer at age of 55, you should be scoped at age of 40. Okay. If let's say your father had a colon cancer at age of 48, let's use Abubakar for instance. Abubakar has brothers and sisters. Abubakar is 48. The example we gave earlier, he's 48. He has colorectal cancer. His brother and his sisters are in their 30s and 40s. So his 34-year-old brother should get a colonoscopy at the age of 40. Okay. So he's 10 years younger than the first degree relatives. or age of 40. Okay. So um, in this case, his brother who's 34 should get it at age of 40, not 38. Okay. Because whichever one comes first is the most important. So age of 40 or 10 years younger than that person who had the colorectal cancer. Does that make sense? You are muted.
Does that make sense? Esther, does that make sense to Gloria? Gloria, do you understand? You understand? Okay, thank you. Next question, please. Unmute, Abuja, you're muted. Unmute, please. Okay.
Are you taking more questions, Dr. Ebere?
Yes, we're going to take two more questions.
Two more. Okay. Just ask this person. Let's go.
Thank you. Great job, everyone.
I want to know what is colorectal cancer. I really want to know what is colorectal cancer. I want it to be broken to our own English. Thank you.
Okay. Dr. Rob, someone wants you to explain in layman terms what colorectal cancer is. She
Okay.
still doesn't get it.
No problem. No problem. So why don't we go back to that slide also? And I'll go over it again. And so we understand what the colon is. The colon is 5 foot long, and is if you have a mouse, if you can just kind of point to it, it's 5 foot long, and it is in your tummy. Okay, so slides. Next slide. So cells in the colon are billions and billions of cells, as you can see here in the colon. That colon
Dr.
that
Rob, can you use another word for cells? Because I think some people there don't even know what cells mean.
okay. So the word cell is just a unit. Everything, for instance, when you're building a house, you need blocks, right? Each block is like a cell for the house. Okay. So the colon has blocks and blocks and blocks of tissue that make up a colon. Imagine the colon being a house, and each one of those blocks inside of the house is a cell inside of the colon. So each block can get something to happen to them. And if that block gets something to happen to it, like mutations, which is cells start to grow, they can become cancerous. Okay. So imagine a block in a house have a hole in it, and then dust is keep coming in from that. That can affect the whole house. So a cell in the colon, when it has a problem, it can become cancerous. So when it becomes cancerous, it starts to grow as a polyp. If you can show me that next slide. And from a polyp, next slide. Yes, yes. And then from a polyp here on the left side of the screen, it can become cancerous because that polyp keeps growing and has lost its ability to stop its growth. And then when it becomes cancerous, the cancer can go anywhere that it wants. The blood cells can carry it to the lungs, to the liver, to the brain. Um, and so what you want to do is you want to catch it when it's very, very early at the level where it is like a polyp here, as you see on the left side, than when it's too late, as you see on the right side here on the of the screen. Does that make sense?
Is it better now? Does she understand about colorectal cancer now? Oh. You understand? Yeah. Okay. Thank you.
All right. Thank you, Dr. Rob.
Thank you.
Is there another question before I ask Dr. Rob my own questions? And if Chief Joseph Buba has a question, we
That's
would
the
love
last
to
one.
answer it. Does Chief Joseph have any question for us?
Now,
No? Okay. Dr. Rob, let me ask Dr. Rob one question. So Dr. Rob talked about cooking. Oh, there's someone that has a question.
React, react.
All right, she wants to know the difference between house and
That
colorectal
thing is not loud.
cancer.
The mic is not
Okay, I
loud.
heard her. I heard her.
You're not
Dr.
hearing.
Rob, I heard her. Dr. Rob, she said, what's the difference between hemorrhoids and colorectal cancer?
So hemorrhoids are not is not cancer at all. It's just a growth on your anus that is caused by a lot of pushing and straining. Okay, if you don't eat a lot of good food, if you don't eat a lot of food, live some uh, foods that are rich in fruits and vegetables, a lot of leafy vegetables, a lot of high fiber foods. If you're not eating a lot of those things, you're gonna end up with a lot of straining and pushing and hard stool. Okay, so we have hard stool. What end up happening is that the hemorrhoids, which are actually there to protect the anus, they get swollen and they get become a big pile, and it just causes a lot of pain and sometimes bleeding. They're not the same as cancer, although their symptoms can be similar, but they're not the same as cancer. In order to know the difference, you really have to have a doctor take a look. um, Never put your head in the sand like an ostrich, never try to wish it away. Always, whenever you have any symptoms, anything that won't go away after 1 month, go see a doctor. And don't be afraid, okay? Because you're doing it for you and for your family, okay?
Right. Dr. Rob, you said hemorrhoids are protective. Like, can you expound on that? And secondly, does hydration decrease hemorrhoids?
Yes, hemorrhoids are actually, we were all born with hundreds of hemorrhoids when once we were born, we got hundreds of them there. But three of them actually grow to be protected. That's what they call hemorrhoidal cushions. The word cushion is for protection, right? And the pillow is a cushion, right? It's to protect the anus because I guess when God was creating us, He knew that somehow, somewhere, some of us are not going to drink enough water, some of us are not going to eat the right food, and some of us are going to strain when we're having a bowel movement, and then we're going to tear the anal skin when we are pooping. So the hemorrhoids are there to actually act as a cushion, as a protection. So that way, when you're having a bowel movement, you have the stool being navigated out nicely, so that we don't tear up the inner skin. So that's what it is. So the second question you had was hydration. Absolutely. So if you're not drinking enough water, you get hard stool because you know what the colon does. The job of the colon is twofold. It's really to absorb water and the electrolytes, and also to form stool so you can poop it. So if it stays in the colon for too long and you don't drink enough water, the colon will absorb all the water there is in that food as much as it can because you're not giving them enough. You just absorb everything, and then guess what happens? You get really hard stool, and then oh, Dr. Abera is drinking hot water. Oh, look at that jug of water. Oh my God, that is amazing.
Water.
Yes,
Water.
that is amazing. So you need about 2 liters of water a day. And for those of us who don't drink enough, yes, you need to drink enough.
Thank you. Thank you for that, Dr. Rob. I know when I was in Nigeria, as a kid in Nigeria, I didn't think we drank enough water. I know water is expensive, water is not free. So it's a luxury for some people. Chief Joseph Bubar, maybe that's something initiative that you can, help the people. Just start with drinking water because drinking water would decrease constipation. It would also increase the movement of stool and it maybe possibly right decrease colorectal cancer. Can I say that, Dr. Rob? Or not
Um,
really, because you talked about stool staying in your colon for so long and can be dangerous. I'm just asking.
yeah, I mean, I think coupled with so a lot of things are additive. There's no is independently. There's no correlation between drinking enough water and decreasing colorectal cancer, but what that does is obviously helps with colon health, and combination with high fiber food will allow you to move your bowel easier and regularly. Some people don't move their bowel regularly. Some people would still be sitting in the colon uh, for like days and weeks. And depending on what you eat, now the colon, those building blocks of the colon can see all this, whatever you eat, all the carcinogens, whatever you ingest, and for a longer period of time because it sits in the colon for a longer period of time. You're not really flushing it um, regularly, you know.
Doc, I have another question for you. I don't know, Esther, can you answer this? I don't know the population in Abuja, but do most people use firewood to cook? Because you talked about the smoke from firewood being a carcinogen. Do a lot of people cook still that way?
Okay. Okay. Dr. Ibiri.
Yes.
Hello.
Yes, I can hear you.
Okay. Yes, we most people use firewood because Abuja we have a lot of rural settlements. We have what they call suburbs community, and then these people, most of them cannot afford the gas or stove. So what they use is firewood to cook. A lot of them. Like I saw some wild coming. I saw some wild entering the community. A whole lot of them in the suburbs, below average income earners, and then coupled with the, you know what's happening in Nigeria, the economy situation. So most people are turning away from using gas, which is very expensive now, to using firewood.
Okay, thank you for that. Dr. Rob, I don't know if you know this, and I apologize if I'm putting you on the spot. For people that don't have the option or alternative in cooking, what can they do to decrease their risk of carcinogen exposure while cooking?
No,
Thank you.
this is a great question, a very very good question. I'm glad it was asked. You know, I think the answer or the remedy to any problem is first is awareness. Now that we know, now that you know, what can you do? There's several things you can do. One, you want to make sure that the place you cook can have adequate ventilation, right? Obviously, you got to make sure that the window is open when you're cooking, and so you can get the smoke out. If you're cooking in a closed space, and you want to make sure that you cook more on the in the outside than the inside, you know. So now that you know, do you think you have to cook in the outside all the time, or can you cook outside? So those are things that you have to start taking measures to kind of reduce it. And then if you're cooking inside, do you have to stay inside there the whole time while you're cooking, or can you just exit each time and just keep the door open and let things just disperse? These are the things that I would suggest one should do in order to reduce that risk, right?
Very good. All right, we're going to end the presentation now. I'm going to hand it back to Vera. Again, we have some goods for everyone, for most people that attended. Again, those goods were provided by Love Your Menses. Thank you so much, Chief Joseph Buba, for having us. Hopefully, when Dr. Rob and some of us come back, I hope you invite us to your palace so that we can come and provide medical work for your community. We love you all. We are one Nigeria, and we are so grateful. Thank you. Thank you. All right. Thank you
Okay,
so
thank you
much.
so much. So are we having Vera talk? Is she connected?
No, she's not. So you can go ahead and
Okay.
continue.
Okay, let me
Mhm.
just have the chief give some words, some vote of thanks.
No problem.
For this lecture, and we pray God should give all knowledge to those interested. Whether our viewers and our problem in Africa today
99% in Africa, particularly in Nigeria, and I'm not bringing that to my community, they are all farmers. We with monthly firewood. But the advice I want to give behalf of the company, behalf of the NGOs, if you are cooking, you should make our kitchen with firewood. But the better hand again is that we spot our food outside, poison is there. So please now watch this one, not like this one, to watch this one. But we should not just marry only that person alone. We have to consider our health. Thank you, and we are welcome.
Thank you so much, Chief Joseph. Esther or Ada, can you interpret? I couldn't hear him well. Dr. Rob, did you hear him?
Okay,
Okay, go ahead.
okay. The chief is actually extending his gratitude for the talk, most especially to Dr. Rob for the cancer awareness. Then he added his own point of view concerning what Dr. Rob has said in respect to smoke. So he tried to say that um, he's taking statistics that 99% of Africans, bringing them down to Nigeria, then bringing it down to his community, use firewood to cook. Nevertheless, he's trying to advise that he's trying to advise members of his community to be able to ventilate where they are using to cook. They should not get stuck or suffocated because they are using firewood. They should be able to open up the kitchen, the windows, whatever they are using to cook, the building where so breeze will come in to avoid the smoke interference in our body system. So he further appreciates Dr. Rob and Love Your Menses for this great program. And he's looking forward for more to come. So he's saying thank you once again.
He is very, very welcome. We look forward to
Wow.
partnering with him and providing more education for his community. We love your menses. We believe in community. We believe in community education. That's something we can give back. We're proud to be Nigerians. We're grateful for America for accepting us. Thank you again. Goodbye and continue to enjoy yourself. Again, the gifts is from Love Your Menses. I know there's more than 300 people. For those that cannot get any gift from us, we apologize, but we think education is really the best gift. Thank you.